Menopause is when the ovaries stop functioning around the age of 50 to 53. By definition, includes not having a menstrual cycle for 12 months. When the ovaries stop functioning, there is no more production of estrogen and progesterone. Estrogen has many essential functions in the body, and the lack of estrogen is a risk factor for chronic pain. I get asked if there is any benefit for pain with hormonal replacement therapy, or if there is any particular diet or exercise that the woman can do to correct the low estrogen levels. So let's talk about menopause and chronic pain today. First, there is no evidence that hormonal replacement therapy, HRT, is helpful for chronic pain during menopause. If the person needs HRT, it is for other indications, mainly to reduce the symptoms of hot flashes, irritability, insomnia, or dryness. Menopause causes two types of problems: the symptoms of menopause and the consequences of menopause. Menopause symptoms are symptoms that the woman will notice. They are usually what brings the woman to the doctor because she can feel those symptoms. They are night sweats, hot flashes, irritability, bloating, weight gain, and dryness. But the consequences of menopause are things that the woman will not notice. These are silent. She will not even know that they are happening in her body. These include loss of calcium in her bones, and which may lead to osteopenia and osteoporosis. Sarcopenia, that is, the muscles get weaker and the muscle fibers are replaced by fat tissue. Changes in the fat distribution. A younger woman tends to accumulate fat around the hips, but after the menopause, that fat tends to shift to the abdomen. And the pain system is also regulated by estrogen. There is less production of endogenous analgesics after menopause. Well, let me remind you that this video is not intended to replace medical advice. If you have a condition that needs medical advice, please talk to your doctor. This video is for educational purposes only, and if there is an emergency, please go to the nearest emergency department or call an ambulance. So, when we put all of this together, the lack of muscle mass and calcium in the bones, more fat in the abdomen, less production of endogenous analgesics in the brainstem, insomnia, and weight gain, all of this predisposes the body to have more pain. Many women reduce their levels of physical activity and practice sports, and they start gaining weight and sleeping poorly. It is essential to identify this pattern and avoid the symptoms with some strategies. For example, talk to your doctor if you are a candidate for HRT. Usually, if you are below 60 years of age, your doctor can prescribe a skin patch to maintain the levels of estrogen for a few more years. Also, it is essential that you prevent weight gain, especially fat around the abdomen. We know that fat tissue produces adipokines. Adipokines are pro-inflammatory substances, and they produce a low-grade chronic inflammation in the body, and this inflammatory process may accelerate osteoarthritis and also lead to other problems like type 2 diabetes and cardiovascular problems. It is also vital to try to improve sleep quality. We know that sleep is very important to prevent chronic pain and to reduce central sensitization in some pain syndromes. There is no diet or supplement that will increase the levels of estrogen, but it is recommended that you stick to an anti-inflammatory diet and continue having your vitamin D daily. And talk to your doctor if you need supplements of calcium or not. And last, menopause is not a disease. It's a normal phase of life. If you are in menopause, you are a privileged woman because it means you are living well above what many women in the past would not even think of, as the life expectancy for women in the past was less than 50 years of age. Watch my video of 26 exercises for osteoporosis that you can do at home. Thank you for watching. Goodbye.